Statins, you've almost certainly heard of them. They are one of the most prescribed drugs on the entire planet, and for good reason. They're a massive weapon in the fight against heart disease. But their popularity also means there's a ton of chatter about their complicated side.
Just how popular are we talking? Well, in the US alone, more than 40 million people rely on statins every single day. That is a staggering number, and it really shows you how critical these drugs are for managing heart health for a huge part of the population.
But let's be honest, for a drug this common, you've probably also heard about the side effects, right? Especially muscle pain. So, what's the real story here? Are these concerns just noise, or is there something really important going on that you need to know about? We're going to break it down. So here's our roadmap for this explainer. First, we'll get into the nitty-gritty of how statins actually work. Then we're going to tackle the number one complaint, muscle symptoms. After that, we'll look at what happens when it's more than just simple pain, explore a very rare autoimmune reaction, and then, most importantly, wrap up with how all of these side effects are managed. Let's dive in.
All right, first things first. What exactly is a statin doing inside your body? Let's get right to the fundamental mechanism.
At their very core, statins are just cholesterol blockers. They work by putting the brakes on an enzyme called HMG-CoA reductase. I know, that's a mouthful. So just think of it this way. Imagine your body has a cholesterol factory, and HMG-CoA reductase is the factory foreman. A statin walks in and basically tells that foreman, hey, let's slow production way down for a while. And that simple action is incredibly effective at lowering cholesterol levels. Okay, so we know how they work their magic. Now let's talk about the main reason people sometimes struggle with them: statin-associated muscle symptoms, or what doctors call SAMs. This is the big one.
And when you look at the numbers, it's pretty fascinating. You can see that the vast majority of people, we're talking 85 to 90%, take statins without any muscle issues at all. But that other slice of the pie, that 10 to 15%, is still a really significant group of people who do feel some kind of muscle pain. It's not most people, but it's definitely common enough to be a really big deal.
So why do some people get these symptoms while so many others don't? Well, a huge piece of the puzzle is that not all statins are created equal. They generally fall into two main camps, lipophilic and hydrophilic. And as you can see, these categories include some of the most common prescriptions out there. This difference is absolutely key to understanding the risk.
And this slide right here is the why. Lipophilic statins are fat-soluble. That means they can pretty much just slip through cell membranes and get into all kinds of tissues, including your muscles. Hydrophilic, or water-soluble statins, on the other hand, are way more targeted. They mostly stick to the liver, which is where you want them to work. Because they have a much harder time getting into muscle tissue, they have a much lower risk of causing that muscle pain.
So who is most likely to run into these muscle issues? Well, the research points to a whole bunch of factors. Things like getting older, being a female, or having an Asian ethnic background can raise the risk. But it also includes other things, like taking other medications that might interact with the statin, intense physical activity, having other health issues like kidney or liver disease, and even things you might not expect, like an underactive thyroid or not having enough vitamin D.
And this quote from the research really drives that point home. It says, statin side effects are likely to occur more frequently in elderly patients because of multiple comorbidities and use of other drugs that may interact negatively with statins. It just goes to show it's often not just one thing, but a combination of factors at play.
Okay, so we've covered the common muscle aches pretty well, but sometimes the side effects can be a little more complex, involving the nerves themselves, and that critical connection point where nerves talk to muscles.
One of these is something called peripheral neuropathy. Now, the risk here is considered pretty low, but for some people on long-term therapy, they might start to experience numbness, tingling, or even pain, usually in their hands and feet. It's something that doctors definitely keep an eye out for.
And then in even rarer cases, statins have been shown to either trigger or worsen an existing autoimmune condition called myasthenia gravis. It's a disorder that causes significant muscle weakness, and while the connection is super uncommon, it's really critical information for anyone who already has that diagnosis.
Okay, now we need to talk about something that is completely different from common muscle aches. This is a rare but much more serious autoimmune reaction. It's called immune-mediated necrotizing myopathy, or just IMNM.
So what in the world is IMNM? The most important thing to get here is that this is not a side effect. It's an autoimmune disease that gets triggered by a statin in someone who is genetically susceptible. So instead of the drug just causing some irritation, the body's own immune system gets confused and launches an all-out attack on its own muscle tissue. And this image, it shows you exactly how serious we're talking. This is a real muscle biopsy from someone with IMNM. Those dark arrows are pointing to what's called myofiber necrosis, which is the medical term for dead muscle cells. You are literally seeing the immune system destroying healthy tissue at a microscopic level. It's pretty intense. And this right here is the single most important difference. With the common muscle pain, SAMS, you stop taking the statin and the pain goes away. But with INMM, it doesn't. The autoimmune attack keeps going even after the trigger is gone. And that's why it requires powerful drugs that suppress the immune system to treat it, which makes getting the right diagnosis incredibly important. So with all of this information, you might be thinking, what's the path forward? What happens if you're someone who experiences these side effects? Well, the great news is there's a very clear strategy for managing all of this.
Doctors follow a really logical step-by-step process. So it starts when you report symptoms like cramps or weakness. The very first step is to just temporarily stop the statin. Then you wait and see. If the symptoms go away, fantastic. Your doctor might try switching you to a different statin, maybe one of those hydrophilic ones, or just try a lower dose. But if the symptoms don't go away after stopping the drug, that's a huge red flag to start investigating other causes, including that rare IMNM we just talked about.
And this is so crucial. For people who are truly statin intolerant, the story does not end there. There are other fantastic options. Drugs like ezetimibe or the much newer PCSK9 inhibitors are incredibly effective at lowering cholesterol. This means managing your heart health is still completely possible.
And this all points to a really fascinating future, doesn't it? We know that our genetics play a big role in all of this. So just imagine a future where, with a simple genetic test, your doctor could know before they even write the prescription exactly which statin is the safest and most effective for you. That kind of personalized medicine, it's not science fiction. It's exactly where this research is heading, and it promises a future where we can get all of the incredible benefits of these drugs with none of the risks.